I was already looking at the lower limb amputations, and we have looked from the level of the hip. Let's say this is the hip coming down to the knee joint, coming down to the ankle, then your foot. Okay, so we are now looking at the last level, which is what amputations of the foot. Sorry, toe or foot amputation. So it could be the foot, okay, any place, any cut around the foot, or any cut around the toe. I have 5 toes, so any amount. Okay, so get to talk about reasons why this amputation is done. One of the reasons why, which you should never forget, is what diabetes mellitus. Somebody's having diabetes and you have vasculopathies, blood vessel complications. You might just want to go and cut the place out. Okay, so it refers to surgical removal of one or more of the toes or any part of the foot, or sometimes they are removing the entire foot. That means what? All the toes have been removed automatically. Okay, of course, if you remove any part of the foot, the toes too are out. Okay, so medical indications. When will you actually want to do this type of surgeries? If the person has had a crush injury, so you have had a crush injury, a burn, or a fracture that has not been repairing. So the tissues there over time are decaying, necrosis, gangrene. So also infections like gangrene, osteomyelitis, and also diabetes foot ulcers or diabetic foot infections that cannot be controlled. You might just want to go and cut it out, because if you don't cut it out, it will actually spread to other parts. So vascular disease too, and also tumors, congenital deformities. Okay. So types of amputation, we have the toe amputation, we have the toe amputation, removal of one or more of the toes. We have ray amputation, where there is removal of a toe plus its corresponding metatarsal bone. So I remove the toe, I'll come here, still remove the metatarsal bone that gives rise to this toe. Then we have the transmetatarsal amputation, where you are removing the foot across the metatarsal shaft. Okay. Then midfoot or hindfoot amputation, below the knee amputations. All these are types of amputations that could be done around this region. So surgical principles is, you always make an assessment to make sure that you are removing only the tissues that are damaged. The tissues that are good, please always preserve them. Ensure that the blood supply is good. Shape the stone. The part that you are leaving, always shape it so that it doesn't cause some one or two disturbances. Then after that, pain control, infection control after the surgeries. So make sure you care for the wound. Make sure you rehabilitate the person. If there's prosthesis that can be put there, make sure you put it, and make sure that the type of shoes the person will be wearing will be shoes that will actually be able to accommodate the condition that this person has.